different versions of MDFT with different systems, teenagers with different combination of problems requiring different levels of care. So there's been some variability. We've looked at the ingredients and processes. What does it work? What are the key ingredients? Try to identify those. We've looked at therapist competence and therapist development and how we can help that aspect of it. There have been rigorous efficacy studies, randomized clinical studies. There have been effectiveness studies. How does it work in the real world or not? We've looked in special settings, MDFT in drug court. We've looked at MDFT as an alternative to residential treatment for teens who were referred and approved for residential treatment. They got randomized to MDFT or residential. We've looked at, there are economic and cost studies of MDFT, and there have been implementation, transportation studies. Can you take MDF to a different setting, and how does it work, and what are the key features? We've done studies in urban and rural settings, various ethnic and racial groups, teens from typically 11 to 18 in multiple countries, as you know. Looked at substance abuse problems, co-occurring mental health problems, juvenile justice involved teens, child welfare involved families, and even carers with mental health, criminal justice, or substance abuse problems. So again, a lot of diversity. I mean, we've been doing this research for a long time, so it adds up. These are some of the studies. I'm not going to run through them. Here's the grand chart of outcomes. I will go through this. This is collected from all the MDFT studies. So let's look at substance abuse. Is this the little thing? Yeah, okay, substance use. We find that teens who get MDFT are more likely to abstain from drug use. There is a more significant decrease in the frequency of drug use. So if they haven't abstained, they reduce their frequency way down. There's a more significant decrease in drug use problems. So there's actual use frequency, how much you use each day, how many days. And then there's problems associated with use, the context of the use. Are you using alone? Are you using with friends? So on and so forth. And there's been a significant decrease in use and also the problems. There's been a more significant decrease in delinquent and criminal behaviors among children who get MDFT in comparison to the various comparative treatments. MDFT use show greater decrease in aggression and violence. MDFT teens are less likely to be arrested or placed on probation. And this is a new finding, which I'm very excited about. MDFT teens are more likely to have decreased felony arrests and serious violent crimes. So in the U.S. felonies, you know what felonies are? You know, the more serious crimes. And we did a study where we looked at arrest records and also self-report of the kid, and they were both consistent, and the MDFT showed a greater decline on those really violent, egregious kinds of crimes and felony-type arrests. So that's very impressive. Then we also look at mental health symptoms, because of course, most of the children have comorbid mental health problems. And MDFT shows a greater decrease in overall mental distress, in internalizing disorders, and in symptoms of depression and anxiety. Well, those are internalizing disorders. MDFT also shows a greater decrease in parents' reports of internalizing disorders. Parent report on their kids' problems. In the family area, we see a more significant increase in positive family interactions, an increase in positive parenting practices, and particularly monitoring their children better, and in the implementation of authoritative parenting practices. And MDFT shows greater reduction than comparison treatment in family conflict, hostility, and violence. Finally, the peer. MDFT shows a more significant decrease in affiliation with delinquent peers, so kids who get MDFT in comparison to other treatments show a greater decrease in affiliation with delinquent peers, so that's a good thing because that's a risk factor, of course. And then the school, this is also, I I think, really interesting. There's more significant improvement in academic and conduct grades, and in a decrease in absences. So this is unbelievable, right? When you look at it, the outcomes are very impressive, and in really high quality randomized clinical studies. And what do people say? This is Lisa Onken, Chief of Behavioral Sciences Branch at the National Institutes of Health, and she says MDFT treatment outcomes are among the best there are for adolescents. Not only does it work, but it joins the category of behavioral interventions whose effects seem to endure after treatment. And that's really important, endure after treatment, because I ran through this list of outcomes. And one thing that's most remarkable about MDFT is that we've done studies where we looked at kids and families over time, 12 months after treatment, 18 months, 24 months, some studies took 48 months. And what we find consistently is that, any good treatment will reduce symptoms and problems while the child is in treatment. So good individual CBT, pretty much any good treatment will reduce while they're in treatment. But what typically happens is when treatment is over, then the symptoms start to go back up, sometimes to intake levels or sometimes worse, right? But in MDFT, in all these studies, the treatment gains maintain. And that's just the amazing thing, that the results, it's not only at the end of treatment, but 12 months, 18 months, 24, 42. And that's why we're so jazzed and excited about MDFT. Well, because of all these great results, many organizations here in Europe and the US have done reviews and have rated it highly. So in the US, we have, this is from, again, our Department of Health and Human Services. This is called the National Registry of Evidence-Based Programs and Practices. Actually, it's a great resource. They have all kinds of programs from little babies, to adults, I think, too. And MDFT got a very high rating. There's another one, the California Evidence-Based Clearinghouse for Child Welfare. Again, MDFT gets a high rating. There's a lot. National Institute on Drug Abuse, Drug Strategies. And recently, we've been endorsed by the Canadian government and by the U.S. Department of Justice. So it's just